Dr. Rolando Toyos is joining us now. This book is just such a coincidence it's coming out right now.
Yeah, Optimum Health in the Pandemic Age. It's been a year and a half, and I was writing a health and wellness book, and one chapter was on pandemics. In October, my wife and I were supposed to go to China to work with a hospital there on a research project. And they said, maybe it's not a good time to come. We think we have a SARS outbreak. So the more and more that it got more serious, I started writing and reading on pandemics more and made it part of the book. Social media now, somebody has an idea or somebody says something and then it can go viral. And I think people are searching for information. And if they don't have a background, everything seems plausible. So what I do is I actually take you through kind of the history, what to believe, what not to believe. When something comes up, you can discern whether it's something that you should really put a lot of stock into.
What are some things that you've done differently, and what are some things that you think will never go back to normal?
Well, one thing is like the way we're communicating and doing things, I think will be this is going to be for the future. So telemedicine is going to be here. We already do universal precautions, but what you're going to see more is the washing the hands is going to be huge. Anytime there's a flu outbreak, you'll see masks. That's going to be part of universal precautions, just assuming that everybody is infectious and couldn't infect you. And I think patients are going to come into even a restaurant and expect you to have universal precautions. There's this whole push for a well building, a building that will actually take into account the health of your employees. These are things that we've already kind of been thinking about. And then if you read the book, it's things that you can incorporate into your, not just in a practice, but you can incorporate in a home.
Optimum Health in the Pandemic Age. You can get it on Amazon right now. Thank you, Dr. Toyos.